Hey everybody out there, I'm in the studio and I'm stealing it from Darren today. We're going to talk some hygiene stuff. So, I have been in a lot of offices and I hear consistently, especially when we walk into your office, hey, we haven't treated perio the way we should have been. How do we do that? So, let's go back to some basics, and if this show is focused more on hygienists, so be it, but the whole team can listen and learn. Hygienists. If you go to the American Dental Association, the Center for Disease Control, or the American Dental Hygiene Association, throughout the country, maybe not in the pocket where you live, but generally in the country, the periodontal disease that should be treated is between 50 and about 80%. Some areas more, some areas less. And yes, if you're thinking, my patients are healthy, the ones that come in consistently do tend to stay healthy. But oftentimes when we come into an office and perio has not been treated either to that magnitude or at all, we always get the deer in headlights look of, how do we do that? When somebody's been a patient here for 15 years and all of a sudden we're talking about perio. So again, let's go back to basics. We're going to talk standard of care, hygienists. When you were trained that 3 and below is healthy, 4 and above is not healthy. I hope we're on the same page because it's not my rules, it's the rules of our license. So when we have a patient, are we willing to look at them and go, I'm going to measure your gums. I know, Mr. Patient, you've been here for all these years. I've measured, not told you, but I'd like to tell you something new today. I want you to listen to the numbers because these numbers tell you if your gums are healthy or not. 1, 2, 3 is healthy. It's the way God made you. It's reachable by floss is what it really means. 4 and above can mean disease, infection, or we're concerned that you're going to lose your teeth. So let me get all the way done and I'll let you know. Hygienists, please say the numbers out loud. If you have somebody to help you, it's not because you need help. It's because we are trying to elevate patient value. If we can set the stage early and frame it, as we say at AMP, frame it, do the treatment, have the patient own it, all of a sudden that's a partnership. And when we have a partnership, the patient owns their disease, their health, and they're more likely to be engaged to say yes to treatment, all the mindset stuff that we teach at AMP. So let's go back to the standard of care. 1, 2, 3 is healthy, 4 and above is not healthy. Whatever word you want to say, inflammation, disease, infection, lose teeth. Please use the word lose teeth. For those of you that have patients that have been long-standing patients and you haven't treated periodontal disease and you've been doing bloody prophies and now you want to do something better for the patient and your neck and your hand and your back and legally you want to treat this patient to the standard of care, here's how you do it. So listen up. Set the stage. 1, 2, 3, 4 and above. Do the whole measurement of all of their gum depth pockets. Record it, either yourself out loud or with help, preferably with help. Sit the patient up, eye to eye, always. Take your glasses off, take your mask off, take the time. I know you're thinking I only have an hour. Take the time and don't even clean their teeth. Take the time to educate them. Mr. Patient, did you hear the numbers that were above 3 in the back of your mouth? You have 6s back there. Use your hands if you like. Here's healthy. Here's loss of teeth. You're here. I'm concerned about you losing teeth. We're in a crossroads, Mr. Patient. I know we haven't done this before. I can only tell you your diagnosis and the disease level today. Here's what I see today. You've lost half of the bone around your tooth that supports your tooth in the jaw, in the back of your mouth. I'm concerned about you losing teeth. If you choose to say no to treatment, you'll likely lose your teeth at one point in your life. You have a lot of lifespan left. We can address this today, keep you from the periodontal surgeon. He's a surgeon that cuts gums. With 6mm pockets, you've lost 50% of the bone that supports your tooth in your jaw. If you think about your tooth like this is your tooth, this is the part that's in the jaw. The bone should be here, now it's here. Once you have periodontal disease, you will have it always. What we can do today is help you stabilize it. However, I could do all of this treatment for you today. If you don't partner with me and do what you need to do on a daily basis, brush, floss, I'll show you how to do that properly, we'll both fail. So keep in mind that it's a partnership, and if you're not willing to do the partnership, please say no to treatment, because you'll spend a lot of time, effort, and energy and money on failure. Don't want failure. So what does that look like? And again, hygienists, this is all in a conversation with you and the patient. Please take the concept and use your words or copy mine. I don't care. So when you get to the crossroads of here's what you have, here's how we can take care of it, here's your part. Right then, sell your 3-month recall. And I'm going to say the word sell, because if you do all of this work and they're not willing to come back in 90 days, what's going to happen? So I encourage all of you clinicians out there, tell the patient what's going to happen.